And we are live on YouTube. So, good evening, everyone. Good evening once again. It's a great pleasure to be here. Of course, it's always an honor to be having this monthly YouTube live section with all of our community. If you are listening to me for the first time, my name is Florence, and I'm the Feminine Health and Hybrid Network. So, I just want to confirm that I'm very audible before I go on. Can I just? Okay, all right, thank you. The executive director in person of Mrs. Stone won't be able to join in tonight. She had an emergency, but she extends her apology. So I'm just going to be giving a brief insight on what Feminine Health and Fibroid Network does, especially for those that are joining us for the first time. So Feminine Health and Fibroid Network is a community that creates spaces for women to be able to educate, empower, and support women navigating fibroids, reproductive health challenges, as well as other feminine health related issues. We've been having this YouTube live conversation for a while now. Actually, it started as our Instagram live, but it's a pity that Instagram got, disabled, but we are working on bringing that up. So, our conversation tonight is going to be around pain. So, we want to talk about when pain becomes normal, the impact of ignoring symptoms over time. And I'm very sure this is one thing that every woman and even the male gender can also relate to, of course. So, honestly, you will agree with me that women have been conditioned to endure pain. And I'm talking of painful period, pelvic pain, heavy bleeding, and all of that. And that is what we're going to be talking about today. It's a pleasure to have Dr. Shegun with us tonight. And it's also a pleasure to have Mrs. Adeola Salako in person of Miss D. In order not to waste time, I mean, our time has been fast spent, so we'll be diving straight into our section tonight. But we also love to let you know that if you're watching on YouTube, you can just send your question, whatever it is that you have, in the comment section, and it's going to be addressed by our speaker. I guess we are ready to go. So, Dr. Shegun, I will be starting from you. I mean, our audience are just meeting you for the first time. Do you mind giving a little bit of introduction about who you are?
Thank you very much. I hope you can hear me clearly.
Yes.
My name is Shegun Lesami. I'm a gynecologist. I currently work here in the UK. And I've been doing gynecology in some form or the other for more than, I'd say, 20 years now.
Wow.
Mm, thank you.
Thank you so much, Dr. Shegun. And you can see that, yeah, the round of applause is actually very important. You can see the amount of experience that Dr. Shegun is bringing tonight. It's amazing to have you here. Thank you so much, Dr. Shegun. Miss D, do you mind gracing us with a little bit of introduction about yourself?
Yeah, good evening, everyone. My name is Diola Salako. Everybody knows me as Miss D. I've got so many. I've got so many hats on. But
Wow.
I train as a secretary. I also have a law degree and social sciences degree.
Wow.
I work in the UK in a hospital. Imagine
Wow.
others. So I work in the pathology department.
Wow. That is actually amazing, Miss D. Truly, you have so many cards, and it's a real pleasure to have you here with us today. And I can't even wait to, learn from your experience and also that of Dr. Shegun. I have my own personal questions, of course, and I can look forward to, you know. So let's just dive in. So my first question for you, Dr. Shegun, would be we are going to be starting from the basis, right? We often hear phrases like period pain is normal or just endure it. And, it's something that is very common in our world today. So by the time you are experiencing one pain or the other as a female and you go to the hospital, the doctors are like, oh, don't worry, just endure. It's normal. It's not something serious. I mean, from a medical perspective, I would just want you to share with us where exactly you draw the line between a normal discomfort or pain and when there is actually an underlying signal of a particular condition.
Thank you very much for the question. So, of course, I guess the first things first is so that one doesn't also become prescriptive, rather,
Mm,
is to always remember that if a woman is telling you that pain is painful, then that's all it is. She shouldn't be forced to sort of measure it against. Is it like dropping a ton of bricks on your toe? Is it like shutting your door, your hand in a door, or whatever? So that's the number one. The thing is, with period, people will experience some kind of pain. It's difficult to say what one person's mild pain would be compared to another person's mild pain. But ideally, it should be, the sort of mild pain that is predictable, and just it should last probably only about a day or two. And it's the sort that you take a paracetamol and you just feel very, you feel okay. If you wanted to just use a hot water bottle that evening or whatever, that should just be that. But once the pain gets to the extent that, it's stopping people from working, from sleeping, it's
mm,
radiating to other parts of the body, especially like the lower back, it's radiating down to their thighs. It is starting, for example, several days before their periods would normally start. Or they now find they are now wanting to reach for more pain relief or multiple pain relief. So they've taken paracetamol, then they start thinking, where did I put that ibuprofen? Where did I put that something else?
mm,
Now, that's the one that you have to start questioning that what's going on here. Now, of course, depending on the population you're dealing with, especially once you're dealing with ladies of Afro-Caribbean descent that are already like, they're already crossing their teens, entering their early 20s, you have to start questioning, could there be fibroids here? Could there be endometriosis? Missing school, missing work, it's not a normal thing at all. Missing
mm,
childcare duties, these are not normal things. So once it starts straying beyond that, then I guess for the person self-assessing themselves, they have to start thinking, you know what, this is no longer, and just put up with it. Different people have different pain thresholds, I have to say. A mom can want to compare herself to her daughter,
mm,
which should ideally not be the case, or would want to compare siblings, again, should not be the case. Because always, I think if we come from the standpoint that once a woman is coming out to say, look, this is pain, then you have to start exploring that.
mm. Wow,
Thank
thank you
you.
so much. Thank you so much for that, Dr. Shegun. And before I move on to Ms. D, there was actually something you mentioned, and I would love you to, explain that more. I just wanted to ask, is it normal for women to take paracetamol, ibuprofen whenever you're feeling pain? Is it okay? Is it safe?
The simplest answer, yes, it is safe. Of course, if you don't have any underlying health conditions that mean you shouldn't take these medications, then it is safe to take. It is safe to take the general grouping is called non-steroidal anti-inflammatory drugs. So things like the ibuprofen and things in that class. Of course, people that have asthma, ideally they shouldn't take it. Well, there are some people that have asthma that will tell you they take it, but it can precipitate an attack, so it's not advisable. People that have had ulcers before, it is not advisable that they should take it. And everyday person taking it should consider taking it with food. But of course, if you find people are having to take it long term, it's useful that they've seen their doctor, it's prescribed, and they've also been prescribed something that protects their stomach. But yes, it's common. That I said it. Some people will have mild pain, and they can grin and bear it. Some people, the mild pain makes them reach for some paracetamol, some ibuprofen. But again, once it starts getting to an extent where you start planning your week around the period. So you already planned that you finished all your work on the Monday or Tuesday, because Wednesday, Thursday, you just won't be able to face up to being at work. Yeah, it's beginning to need something doing.
All right, thank you so much for that, Dr. Shegun. And a key thing Dr. Shegun actually mentioned is that it depends on your health, of course. If your doctor already prescribed that for you, then it's safe. So, Mrs. D, my question for you, I love your wealth of experience. It's really amazing. And I'm coming in contact with you for the first time, but Mrs. Tony, of course, gave me a brief introduction as to who you are, and I couldn't just wait to speak with you. So I just wanted to share about when you first realized that the pain you were having was not normal. I mean, you are a woman wellness advocate, and at some point in your life, you of course you were experiencing some kind of pain that to you it thought, oh, it was just the normal pain, but at some point in your life, probably due to medical treatments or doctor's visit and all of that, you realize that it was actually it was actually more serious than you thought it was. So I just wanted to explain, at what point did you realize that the pain you were experiencing wasn't normal?
Well, thank you for the question. Well, my kind of pain is totally different.
Mm,
Yes, I know with women we have menstrual pains, we have things like that.
mm.
Mine was actually more of back pain,
Wow.
which led to nerve impeachment.
Wow.
And I took it. I'm one who I've got a very high, it's very funny. Dr. Shegun said about some women have different types of pain threshold. I can take any pain. And nobody will know I'm in pain. But on this occasion, um, I would say say 3, 4 years ago, um, I had just a little lump on my right side, and I keep having this stabbing pain in my chest. But I just thought it was part of, physical activities, walking, lifting things that I shouldn't be lifting. And I just left it and I didn't tell anybody about it. I did not even mention it because one, it was there, it was very small and I didn't think anything of it. You did say, when did I start experiencing pain? It was when the pain in my chest, sometimes I stand and I have to shout,
Wow.
and people knew there was something wrong, and that was what I didn't want to happen. And of
Mm,
course, because people around me started saying, oh, you might be having a heart attack. Oh, you might be, different things.
yeah.
And that was when I knew, do you know what? I've got to do something about this, which I did. Thank God, because I said I work in a hospital.
Yeah.
Um, I had medical people around me, and somebody looked at the lump and said, oh, it's a lipoma, it's just a fatty tissue. It's nothing to worry about, but go and see your GP. And that was where it all started from. I had to go for tests and everything. And that was when I knew it was the back pain, and a nerve was actually trapped in there. And the x-ray actually did show that I have what they call scoliosis, which is where the spine isn't straight, it's sort of curved
Wow.
in an area.
Wow. Wow. That is actually, you know, I don't want to say mind blowing, but I mean, I'm learning a lot, and I'm sure the women out there listening to you are also learning a lot. Yes. So when you started talking about the pain you were experiencing, my mind already programmed it rather to be a normal pain. And just as you said, I'm a kind of person that I would rather take in all of the pain until I cannot bear it anymore. And it's just people around me that will start telling, oh, Florence, you're not okay. You need to go to the hospital. And I think this should be, for everyone watching there, this should be your reason to go to the hospital and check out whatsoever it is that is wrong. And it's actually amazing because one thing that the Feminine Health and Fibroid Network is trying to do is to publish a journal where you can write down all of your symptoms. So by the time you're going to meet your doctor, you have a list, a detailed list of everything that is happening to you. Because you would agree with me that it's actually very important to be able to tell your doctor every single thing that is wrong with you for them to be able to analyze what exactly the real issue is. So thank you so much, Ms. D, for coming out. I just have a question for you again before I move on to Dr. Shegun. So you said there were some symptoms you actually ignored. So I just want you to share if you ignored all of those symptoms because you've been conditioned to believe that they were normal.
Um, I think I conditioned it not for it to be normal. I just felt one, why am I going? And one, I will say one thing that is, I think with we Africans, especially if you're Christian, things like this happen and you say, oh, it's not my portion. Oh,
Mm,
heaven forbid, my body is, those kind of things. I think that was at the back of my mind, and I felt it's not that serious. It will go. And especially when I take painkillers, and I think I got to a stage where I thought, no, I've got to stop. Because at that point, I was not taking Panadol. No, I was taking something, I'm sure Dr. Shegun will know. I was taking Zapain. I was taking Kuprofen. Those are strong painkillers, and that was what I was taking. And I think in me, I felt, no, I've got to stop. Especially, and I think I felt a little bit not too bothered because I worked in the hospital and the consultant had looked at me and said, it's nothing to worry about. So that's one of the things. And the other thing I think that then that shook me really, really to the marrow was when my thighs, if I stand for 2, 3 minutes, it just goes numb.
wow,
If you hit me or put anything hot on that thigh, I will not feel it.
wow.
I think that was when I thought, right, it might be more.
Mm,
When you start hearing things like, oh, somebody went on a flight, they've got DVT, oh, there's a blood clot, I think that started working on my mind.
wow, wow. Thank you so much, Ms. D, for sharing. And your experience, of course, just brought about a question from our YouTube live community now. And I would love Dr. Shegun to address it first, and then Ms. D, you can also add your own 2 cents if that's fine. So, Dr. Shegun, the question from Mrs. Oluwafunke Oluwaferonmi is that she has been experiencing pains in her stomach, and at first she thought it was just normal, but as of now the pain is becoming too much, and she wants to know what exactly could be the problem and what you will advise her to do, of course.
Okay. Oh, I'm sorry to hear that. I think we covered it already in terms of pain. So, of course, again, she's the one to decide what is painful enough. And from that description, that sounds like severe pain. It's the soft pain that, in my own opinion, I guess there are gradations of it. It is possible that it's pain that is that severe that in our own climb, we'll be asking you to make your way to accident and emergency so that you are seen and assessed right now, tonight. I guess another thing to consider is it can be severe enough pain that you then think, you know what, that's it. I'm not going to be sat here taking long baths, using hot water bottle, chomping on 3 different medications. Tomorrow, I'm making an appointment to go and see my own doctor so that my doctor can then let me know what next. Assessing any one individual, sadly, it's not possible, just by hearing the story and then knowing exactly what's going on. Most times, you can have a set of possibilities, but you need to know the person. So you need to ask a lot of questions of the person: when the pain started, where the pain goes to, and what medicines have helped in the past. Has the person had surgery before? So lots and lots of questions before you now get to even needing to examine. So you wanting to examine, depending on what they are saying to you, it might be top to toe examination, because at the end of the day, if you're seeing someone who, for example, is quite anemic, you might then find out that she's been bleeding quite heavily during her periods. It
Yeah.
could then mean that she's got large fibroids. And you see, your answer starts to come towards you at that stage. You might finish off by doing certain investigations just to ensure that the person is healthy enough. So it's different with healthy enough to consider what treatment you're looking to give, or you want to see how the state of health they are in at that stage, before you then start definitive treatment based on what you might think might be happening. So a lot of steps, but listening to that, to my mind, it sounds like urgently make an appointment to go and see your doctor, because they will be the best people that already know your history. They'll be able to put things together, and they'll be
True.
able to start taking care.
True. Thank you so much, Dr. Shegun. So,
You're
Mrs.
welcome.
Oluwafunke, please make it a point of duty to see your doctor. Miss D, do you have anything to add before we move on?
No, Dr. Shegun has already said it. It's
All
if it
right.
if anything stomach related, I think it's best to go straight to A&E or go and see your GP. Yeah.
Yeah. So, Miss Fumi, please do well too. And of course, if you need further consultation, you can, if you're in the FHF community, you can always drop a question or whatever it is that you need. But of course, make it a point of duty to see your doctor. So, Dr. Shegun, when you started, you mentioned that some of this pain, especially stomach pain, could be leading conditions of things like fibroid and other feminine health related issues. So I just want you to explain what happens medically when symptoms are ignored over time. So do you think delaying some of all the symptoms you feel could affect overall health, could affect fertility? Of course, we know that there are some myth that if you do not do certain thing at certain time, or if you are feeling some kind of pains, one thing or the other. Of course, I had to use the word myth because it is not
Mm.
medically proven, and that is why I would love you to share your own experience. Do you think there are some pain that could be the leading cause of things like infertility and fibroid and all of those feminine health related issues?
Yeah, so I guess we've mentioned it. Of course, feminine health started out of just trying to bring awareness about fibroids, especially within the Afro Caribbean community, and just that silence around it all. Yeah, yeah. The thing is, you recall we talked about pain, so
Yeah.
it right from the start, it was straightforward enough to start determining that, what, this is a bit more than period pain. Then it's not unlikely that that person would have definitely been seen by a doctor. They would have been asked questions. They would have been examined. Possibly investigations would have been done, like scans. And maybe at that stage, we start to find out, what, there's a fibroid here, or there are fibroids here. There are fibroids growing inside the womb. And the thing with fibroids is they can carry on growing. So
Yeah.
I guess that's the first one. So as soon as we're ignoring that, then the fibroids carry on growing. And sometimes until ladies start getting like an enlarged tummy, that's when they then get a sense of, what, this is not weight gain. This is actually fibroids here. My periods are this heavy with blood clots because the fibroid is actually sat inside the womb all this while. I'm
Yeah.
getting low back pain because the fibroid has become that big. It's pulling on my womb, pulling towards the back of the womb. The fibroid is that big and it's pressing on my bladder and making it feel like I'm 4 or 5 months pregnant. And that's why I'm needing to go and pass urine that often. Of course, there's fibroids. Then another common thing is endometriosis. Early days, you might have endometriosis. It might just be a few dots here and there. But slowly over time, as those areas become more, should I say, it becomes more more inflamed. So it keeps sort of shedding, it keeps sort of getting angry, it keeps sort of sometimes bleeding, and all of that can start to cause scarring inside the tummy. And that scarring can then very easily start to affect the fallopian tubes, for example. So it's not unusual that people can then be caught with like, you know, either a pregnancy that gets stuck in the tube, or they just don't get pregnant because the tubes are kinked or destroyed. Um, of course, people can then also have painful intercourse, whereby they then avoid intercourse, and that way they don't fall pregnant. I'm just linking things that just to your infertility type question.
Yes.
It's also possible that that many other things that people can have, as you don't talk in the like I said, in the Afro-Caribbean community, when people don't say it, then it makes it difficult to actually start to investigate. So you miss it when it's, should I say, in the sort of like early stages. When you're getting to look to diagnose it, it has also caused other things. So you're not facing a straightforward, oh, I think it's just this thing. It's now that thing and all the sequelae, all the things that has now happened after it. Of course, there's things like polycystic ovarian syndrome. People are developing facial hair, their voice changes, their periods are, they're getting only 2 periods a year, 3 periods a year. But again, that silence, nobody says anything. So you're not getting the blood tests, you're not checking to see whether you're handling sugars well. So you're not getting a chance to get treatment with metformin, to have a chance to see a specialist that can offer ovulation induction agents and so on. And so these are different conditions can be there. Some of them end up being sort of linked to fertility. Some of them can be pain related, while some it's just the heavy menstrual bleeding related.
Mm. Well, thank you so much, Dr. Shegun. That is actually very enlightening. And I have a question for Ms. D, but before I move to Ms. D, Dr. Shegun, I know you already made mention of this when we started, when you
Yeah.
talked about women taking pain relief just
Yeah.
to, um, more like self medication, really. So there's a question here for you that says, most women self medicate rather with painkiller just to function. Do you think long term reliance on pain medication could have serious health risk?
I think the question answers itself. Yes, if you're having to rely on pain, depending on how strong these pain killers are, then yes, of course, it can be detrimental to health. We mentioned the non-steroidal anti-inflammatory drugs. So, of course, these non-steroidals can start to cause gastric erosion. So, inside your tummy, inside the stomach lining, it can start to cause it to become eroded, or it can cause it to become injured in certain ways. So that's part of why people talk about taking it with food. And if you're needing to be on them long term, which many people can be on, it's just important that your doctor is aware of it, that you're taking it, because what they then help with is they can give you gastric protectant, so something to protect your stomach lining, so that one doesn't then get erosions or ulcerations from there. So you don't want a gastric ulcer on top of things. Then the second part of it is, of course, depending on what kind of medication you're taking, the GP can also consider whether to just make sure your kidneys are functioning as well. Then if people are taking paracetamol, it's important to keep to the dosing requirement. So you're not wanting to take more than 4 grams of paracetamol a day. So 2 tablets, not more than 4 times a day. Otherwise, it starts to affect one's liver as well. So that's part of why the self-medication might not be such a great idea. Sadly, some people might need more. They might need more in terms of needing opiates. Opiates are, medications like morphine. Some people have trade names like other sort of synthetic types, so pentazocine and so on. Now, these can become addictive. And so that's the reason why people need to just show some care if they are using them and using them without without prescription, or or even if they have it prescribed but they feel they are using it way too much. It might
Mm,
just be at this at that stage one starts to consider what exactly is the cause of pain. Can the cause of pain be treated? Otherwise, one might just cause harm to themselves.
mm. Thank you so much for that, Dr. Shego. And the reason why I'm smiling is because, I have a lot of people around me that they take so much dose because they want the pain to go so fast. And I think that is why conversation like this are very, very important, because just as you stated, it could even cause long-term harm like liver pain or kidney, liver infection
Mm.
rather, or kidney infection and all of that. So thank you so much for that, Dr. Shegun. So, Miss D, you shared your experience with us already. And, there's a question for you that says, was there any points in your life where you felt unheard or even misunderstood by people around you or even by the medical professionals?
Like I said, of course, when I have any pain, I don't let people around me know. That is
Mm,
just me.
yeah.
But of course, whilst at work and had that pain, apart from my family, who I always say, but then maybe because of, I don't want to say my upbringing, because my mom was a military woman,
Oh,
so the pain was no, nobody wants to know. You have to do something. That so I've had that in me, and maybe that is why I have a very strong, pain threshold.
mm,
Um, my family knew, and I always tend not to. Sometimes they tell me, "Look, take it easy," but I don't want to look. There's that thing behind me that is you're looking as if you're weak, So it was always there that you have to be well. You can't
mm,
be ill. And that is it. And but with the medical team, I will say it took me visit to the GP and to have been forced to go to urgent care from work.
mm,
And that was when I think the medical profession actually felt there's something wrong with this woman, because I'm not one who goes to the GP. So I believe just going to the GP to say, "Oh, I have a pain here," it was one wasting my time and wasting the
mm,
GP's time. If anybody is listening, please do not do that. It is not good. I'm learning from it now. Don't. It is not good. Because it's now I can see, if I had
mm,
gone, because they say you who don't shout out, then it means you're okay. There's nothing wrong with you.
mm,
And it was the two pains, the numbness in my thigh and the chest pain, which I found it so difficult to even describe the pain to the doctor, which I
oh,
think was the reason they were just dismissing it as, oh, maybe you've just sprained something, or they didn't take it. And because I'm not the one to come, whatever they tell me, oh, do you know what? Just rest, or if the pain is there, just take paracetamol. And that was me. Okay, bye, and that's it. But it took going to urgent care and to be told to go straight to what we call the ambulatory unit. Then I
oh,
think that was where the GPs, the medical practitioners, then think, okay, this woman has to go for ultrasound, she has to go for X-ray, and that was where the diagnosis came out from.
wow. Wow. You've heard from Miss D. Please and please, if you're feeling any pain, rush to the hospital. Do not wait. Do not wait. Wow, Miss D, that is actually, very, very mind blowing. And I can totally relate to your story about having to hide the pain. Always sharing this story about how I was always having severe menstrual pain while growing up. And my mom would be like, my pain is not like this. You can't, because of ordinary menstrual cramps, be causing so much nuisance and all of that. And at some point, she had to understand that, oh, okay, she's not faking it, actually, she's in so much pain. And I think that is what so many people need. It took me going to the hospital, of course, before I could even. It was so bad that I could not go to school throughout the 5 days or even stand, or it it was just so bad. It's not something I want anyone to experience. So please remember to always see a medical practitioner. So Miss D, another question for you is, what has your healing journey taught you about listening to your body?
Well, it's taught me a lot
Mm,
because one, um, it took me too long. Maybe I will have been much healthier. Well, I don't classify myself as not being healthy because at my age, I can do things that a 25-year-old person can do. So, so I thank God for that. I feel great. Um, but the thing is, it's made me do more research.
mm,
Is what has actually led me to the wellness advocacy for men and women.
no,
So I have researched on things like natural remedies rather than going taking painkillers all the time. And there are other things you can do. Then because like Dr. Elisomi said, if you take too much of this, it has effect on a different thing. So why are you looking after A and then you're causing another problem for B? Because the body all interlinks together. So, yes, it's taken me to research into so many things, and I thank God for that also.
no. Thank you so much, Miss D. And really, your story is actually very, very inspiring. And I'm sure it's the same with most women out there. I've been getting so many comments from your story already, and it's actually inspiring. So, Dr. Shegun, wow, our time is fast spent. That is so fast. So, Dr. Shegun, a question for you. So, um, okay, this is a question for Miss Anglo, and she's asking, what specific symptoms do you think a woman should never ignore, no matter how normal they've become used to them? I think Miss D and Dr. Shegun already addressed this, but I don't know if Dr. Shegun still has anything to add.
Bleeding,
Mm,
bleeding, bleeding.
mm,
Sadly, like I said, too frequently, it's oh, you know what? This is what happens in our family. People, we bleed like this. Oh, we're usually our eyes are usually white in our family. We're usually pale lips. That's
mm,
our family. Basically, what it just says is it says in that family there is probably a condition. There might be a condition. It might be fibroids. It might just be just some difficulty with just the way the menstrual bleeding and things starts and carries on, that it's heavy. People are feeling that they should get used to it. And then one day, for some alternate reason, if they are in Nigeria, for example, they've gone to test because they have malaria, and then suddenly you see that their blood count is quite low. It's not because of only the malaria, it's also because that has been them over the years. Their body has just gotten used to managing that, but sadly, only a little bit of thing can tip you over. And that sort of person can very easily, their heart has been doing extra work for years and years. So that kind of person can be very easily tipped into heart failure, for example. So for me, the number one is bleeding. Then the second one is, I know it's not in all climes. Now we're lucky here in the country, here in the UK, people have a very well developed cervical screening program. So whereby they have smear tests, and it is people ensure that the cervix does not have any disease, and the main disease we all worry about is cancer. So, because they are having cervical smears, I always tell my ladies here, you cannot ignore your cervical smear. You need to go for your cervical smear. So that's something that they need to go to. And then if at the cervical smear you see a polyp there, again, you can't ignore it. It's important you go, you have it checked. You have it checked by just removing. And it's usually quite easy and straightforward to remove it. So these are things that people should not ignore. Then, we had one of our listeners that talked about severe pain. Now,
yes.
sadly, it's pain that it's on the one side. Now,
Mm,
a woman of reproductive age group, it could be a pregnancy, it could be a pregnancy stuck in the tubes. That's ectopic pregnancy. It's a killer. So it's important that you have that kind of pain. That's not the I'm going to triple up on my pain relief and then go to bed with hot bottle or hot water bottle. That's accident and emergency straight away. So, and it can also be something that is, can be changing to one's fertility. It could be the ovary. Maybe there's an ovarian cyst. It has twisted on itself. And that ovarian cyst, if you don't untwist it, you lose the ovary. And if you lose the ovary and we don't know early enough and it gets infected, then that's sepsis. So you understand, some evidence would talk about that it is possible to lose an ovary within 6 hours of that sort of pain starting. So which makes it important that people go. Then, of course, yeah, I know I'm a gynecologist, but one needs to say it. You're bleeding from the back passage. You're having pain opening your bowels. Now, these are things that could be endometriosis as well as it could be even something more serious like a cancer. So it's important. So people are having very difficult pain during intercourse. That means they just can't stand or bear having pain, especially when it's deep. They are opening their bowels, it's painful. This could be deep endometriosis, and it just needs someone to see what's going on. Then occasionally, I know in my own training, we never really seem to see much of it. I don't know whether it's also the silence, people just not complaining about it. But once you start finding that when you cough, you're leaking urine, you cough, it feels like something is coming down from the vagina, which is a prolapse. You need to get it checked. Someone needs to get it checked. So these are, and then generally, I think something people are all very good at is as soon as you have a fever, yes, people can determine that, you know what, I think I'm not well, which is good. Of course, in my own specialty, then if you're hearing fever, there's some difficult vaginal discharge, there's lower tummy pain, then one needs to worry about PID, so pelvic inflammatory disease, which if left untreated can then affect fertility going forward. So for me, I think it would be that, bleeding, pain, opening your bowels with pain, with bleeding, and then fever. These are things that you just can't ignore.
Thank you so much for that, Dr. Shegun. And we're having mass number of questions from our YouTube. I would be taking these two questions together so you can just address them both. So there is a question from Deru Nolutuji. I'm so sorry if I don't pronounce the name correctly, but she's asking, what is your take on internal exam not being done if a lady is not sexually active, even when fibroid is suspected? The first complaint being very painful period. And then there's another question from, okay, the same person actually. She said, Doctor, does hormonal migraine from a woman in her 50s? Okay,
So let's go with the hormonal migraine.
okay.
Sadly, that sounds to me like that is menopause.
Mm.
50s, 50-year-old, 50s, it's menopause. Again, another thing that our silence doesn't help us to address properly.
Yeah, and
It's
sorry,
a
Dr. Sher.
natural. I'm
She
sorry.
also wants to know if there are ways to stop it apart from taking medication. So you
Yeah,
can
yeah,
just
yeah. We can talk about it. So the thing to just remember is there's more education out there now about menopause and the perimenopause. Some people are lucky, like a light switch. Their periods will just carry on going regularly, then suddenly it stops.
mm,
They had no symptoms. It stops. 1 year later, they've never had any bleed since. And that's it. That's the definition of being in the menopause. Once you've not had any bleeding for a year, then that's menopause. So that anything that happens afterwards, it's important you get it checked because that could be lining of the womb cancer or endometrial cancer. So, which is why you definitely go and get it checked once you've gone into the menopause and you have a bleed. Now, talking about going through that change, I like how she used it. She said, what was that? Hormonal migraine. So basically, people can have brain fog. So many women, as they start approaching their menopause, perimenopause, the sort of things, I went to school with many brilliant, intelligent ladies that knew far more stuff than the male medical students, I have to say. But you cannot imagine someone like that, that knew how to have things at their fingertips. And then as they start approaching their later 40s, early 50s, they now struggle. They struggle to remember the details of things that they used to reel off like this when they were much younger. And it's people describe it here, they'll say brain fog. Now, some other people would describe other vasomotor symptoms. So things like hot flush, they just feel as if they just stepped into a sauna. Everything just feels hot. They are having night sweats. One moment they are cold at night. Another moment they have the covers off because they are hot and they are sweating. Now, many people will agree that there's not one road that leads to the market. It's common and it's popular to say you can use hormone replacement therapy, and basically because should we say the difficulty in this particular situation is that the estrogen levels have gone low. So because the estrogen levels have gone low, basically you're giving the person some estrogen back by giving them the hormone replacement therapy. If they still have their womb inside, you're wanting to protect the lining of the womb by giving them something that has progestogen. So that's why there are two medications to take, or at least two combination. It's a combination medication to take to help with this period. Now, there are non-hormonal methods as well that can be geared towards treating what is the problem. So for some people that have like the vasomotor symptoms, this sort of heat coming to their face, night sweats, they just find it just difficult to settle because of that. You can decide, you know what, we want to treat you with SSRIs. Now, some people might not like that because they will just think that, oh, you're treating it with an antidepressant, but it does work. It does work. That's why we would give it. Then there are other ways to treat it. Some people have talked about things like using black cohosh. There are different things, different sort of like other herbal medications, and it's made it into guidelines that we can advise women that there are all some of these other things, St. John's works and all these other things that people can use, but it is just the evidence that we have and what we know we are trying to replace. Sometimes it is best to start considering the hormone replacement therapy. Then there are other things. It can be the person is bothered by vaginal dryness. That is their only problem. Vaginal dryness, difficulty with intercourse. And it's just general advice about lubrications, about the different kinds of lubricants that are on the market, over the counter, that can be bought and can be used. And so sometimes you just get towards the particular symptoms. But I like that word. I'm going to hold on to it, hormonal migraine. Um, and for me, I just think that it's important to just be educated about one's symptoms and to be reassured that these medications for replacing the hormone is just your natural medicine. It's just your natural hormone, rather. Your body produces it. It is still producing it in your fat cells, even if you've gone through the menopause. Some of it is still being produced in the fat cells in the body. It's just it's not at the sort of quantity that your whole sort of body needs, that would normally have been produced by your ovaries when you were much younger. Then the first question, if you just remind me, the theme was they were asking about
Yes, she was asking what can one do after doing different.
yes,
Yeah,
what can one do after doing different?
she's asking what your take on internal exam is,
Yeah,
especially when you're sexually active.
it can be very sensitive. It can be very sensitive. Now remember, we can do a scan with jelly on the belly only, so you can scan with through someone's tummy only, and you can see the pelvic organs. You might not be able to see it in a sort of clear enough fashion as you would like, but every day there are better and better scanning machines out there, and people might be able to give you the information you require to at least start off a treatment, or at least understand what might be happening with any one individual. It doesn't necessarily have to be an internal examination with a probe. Now, again, one would prefer to do that rather than examining a young lady that has not been sexually active before. So it's to balance it. Sometimes you find there's someone, she's not sexually active, but she uses tampons. So it's then to check, are you happy for me to use a small speculum to be able to see the neck of the womb. You remember I said sometimes when you're investigating all these things, you're wanting to just think broadly. You're trying to check to make sure that there isn't anything obvious you might miss, whether by doing an internal examination or whether by doing scans or asking all the right questions or doing blood tests and so on and so on. So yes, I've encountered this, and usually what one then decides to do is to do a transabdominal ultrasound scan, and that's through the tummy to scan to make sure that there's nothing immediately obvious. Sometimes they come back to you and they tell you that nothing to see here. Now, the thing with a scan is a scan does not necessarily, a normal scan does not then equal that the person does not have endometriosis. So it can still be endometriosis, it can be on the surface. And the only way to diagnose and be sure that it's endometriosis and possibly even offer treatment is a diagnostic laparoscopy. So that's a camera procedure, keyhole camera procedure through the belly button to look inside the tummy cavity.
Okay. Thank you so much, Dr. Shego. Miss D, would you love to add anything? Yes, so especially the question related to hormonal migraine. Sorry, menopause migraine. Was that the word she used?
Hormonal migraine.
Hormonal
I like
migraine.
it.
Okay.
To be honest with you, I'm one of the lucky ones who didn't have that. I had the hot flushes, and I just worked with it. Dr. Shagun, I also worked while worked in the hospital. The first place I worked in is Ops and Gynae. So
Yeah, actually.
I really knew. So when you were going on, I was going, yeah, yeah, yeah. I remember all those. Yeah. So I just tend to just take it on board, and because I have a very strong pain threshold, I was able to take it to it. I see people, and I really feel sorry for that. I really feel bad for them, but I couldn't do anything.
Yeah. Thank you so. I'm so sorry, everyone. We would love to take all your questions, but our time is fast spent. We have just 5 minutes more, and I saw these three questions.
If you like, you can try to do quick fire questions. I will see
Yes,
if I can.
you can just rush through it. Okay. But I mean, you can always send your questions to the WhatsApp community group chat, or you can indicate in the chat box if you want to be added to it. So, Dr. Shegun, there is this question that says, can cervical smear test be done for a lady who is a virgin? That is one. And then
So
two,
if she accepts, so it's not like the place is closed. It's
mm,
just obviously there is the social side of things that if nobody's been there, you're going to go there. You might disturb the hymen, but usually the way the hymen is, it lets blood flow through, doesn't it? So there could be a method that you can actually achieve an examination. And we have tricks. It's a brush that needs to go up to go against the cervix in a certain way. So we can use small speculum.
okay, thank
Yep.
you so much, Dr. Shegun. And then secondly, what can one do after going for different tests, for example, blood tests, ultrasound scan, and all of that, yet you still get bigger tummy, especially because you're a lady in her late 50s and you maintain very good diet.
So sadly, it might be for me, especially. I'm glad to hear that the scan is totally normal. So big tummy, you would worry about ovarian problems, ovarian cancer, ovarian tumors. So if the scan is normal, that's great. I fear it will be the bowels. It can be bowel related. It can just be because that's where the gas is. That's where the air is. The air is trapped in the bowels, making them look bloated. And then if you ask that same person, they will now tell you that it will just happen on a Tuesday, or Wednesday, Thursday, and then suddenly, come Friday, Saturday, they will just be shocked that their tummy has gone down again. So yeah, it's IBS, sadly.
All right. So, is there anything you would advise her to do?
My
She
own
said she
first
takes
take,
diet, but I don't know what's. Sometimes diet might be good to you, but might not be good for your body.
exactly. That's why I was just going to say that sometimes you just need to double check. As we grow older, many of us we lose the ability to sort of process milk in the in the way we used to, and so you just need to recognize and give it up that you're no longer a baby. that needs to grow with milk. So, and so on and so on. People just need to understand that sometimes some of your favorite foods are causing you problems.
Wow.
Mhm.
Thank you so much, Dr. Shegun. And we're just going to take one more question. The last question is um, I'm trying to get a question, but maybe I should just read it out. It said also IBS has been ruled. So is this just hormonal stuff? So
So
Oh, IBS
it,
has.
yeah,
it can be hormonal, but honestly, it's very difficult to rule out IBS. Nobody sits still and tries you on different diets at different times of the day and with different sort of water intake. Honestly, very difficult. So far, they've ruled out inflammatory bowel disease. So if IBD has been ruled out, so Crohn's disease, ulcerative colitis, that sort of thing. But once you start getting bloating and it goes back down, we've made sure as a woman you don't have ovarian tumor, no ovarian cancer, blood tests are normal. Then yes, you just need to keep tinkering with it. Very small risk that it can be sort of hormone related in terms of you then needing to consider use of HRT. Again, if you're in your 50s, unlikely for it to be endometriosis, but in younger women that have bloating like that, then you can almost start thinking it might be endometriosis.
thank you so much, Dr. Shegun. It's 9 o'clock on the dot, and we
Yeah.
should be wrapping up now. So, even as we wrap up tonight's conversation, one thing is clear: pain should not be normalized. Your body speaks, so listen. Your symptoms are your signals, and early action can save you years of suffering. So this is just a summary from what you've heard from Ms. D and Dr. Shegun. And of course, just as I always love to do, Ms. D, I would love you to, share one last thing with our community, particularly with respect to those that are silently enduring pains. If there is one thing you could speak directly to women, what would you say to them?
Actually, speak out.
Yeah.
Don't bottle everything up. The thing is, the more you bottle it up, the worse it can be.
Yeah.
Because you might be thinking, oh, I've got a headache, and you're trying to, plaster it with Panadol, whereas there's something else seriously happening down there or anywhere in your body. Speak out, seek opinion, professional opinion. If you're not satisfied with one, you can seek a second opinion. But please, ladies, even men, let's take care of ourselves. Let's stop just the foundation and the powder and all whatnot. Our body, we keep saying, is the temple of the Lord, and we are wonderfully and beautifully made. So please look after yourselves.
Thank you so much, Miss D. Please look after yourself. Very, very important. What would you also love to say, Dr. Shegun?
Yeah, I think mine is the same theme. Across the world, it seems like Afro Caribbean women, they are often taught to endure pain, and they make it seem like it's the strength. You can ignore pain; it doesn't mean it's gone away. What it just does is it delays it. It then ends up meaning that your diagnosis comes later. It means your surgery is bigger. It means your recovery is harder. Your grandmother's generation did not have the technology we've got today. They did not have the medications and years of research and fine tuning that we do today. So please, if you're having, you understand, if it is not a character test, if you're having these difficulties, go and see your doctor and you'll be better for it.
Thank you so much, Dr. Shegun. Thank you so much to everyone who joined
Welcome.
tonight. And thank you so much, Ms. D.
Thank you.
Please do well to share this conversation with other women out there. You can join our WhatsApp community, or if you have any question, we are willing to answer. Your doctors are always there. We have very, very, amazing people there that would be willing to address all of your concerns. So please do well to also follow us on all social media platforms: YouTube, Facebook, LinkedIn, at the Feminine Oats and Fibroid Network. Until next time, stay informed, stay empowered, and make sure you take your health seriously. Bye, everyone. Bye, Dr. Shegun. Bye, Miss D.
Thank you. Bye.